Welcome to today's discussion on autism spectrum disorders, understanding and managing it effectively. We're joined by Dr. Francis, a leading developmental pediatrician, and Pharm. Lawrence, a clinical pharmacist with experience in behavioral health. Hi everyone. I'm Dr. Francis, a developmental pediatrician. Today we're diving into something that affects millions of people and families worldwide, autism spectrum disorder, or ASD. And I'm Pharm. Lawrence, a clinical pharmacist. We're going to help you understand what autism really is, what causes it, how it's managed, and how families and communities can offer better support. Autism is a neurodevelopmental disorder. That means it's a condition that begins in early brain development, usually before a child turns 3. It affects 3 main areas: communication, social interaction, behavior, often repetitive, but autism isn't one-size-fits-all. Some people need lifelong care. Others live independently, have careers, and form relationships. That's why it's called a spectrum. Early signs may show up in the first year of life. Some examples: not smiling back at people, avoiding eye contact, delayed speech or not speaking at all, repeating the same actions or words, called styming, strong reactions to certain sounds, textures, or routines. Autism doesn't have one single cause, but science has uncovered several possible contributors. Genetic factors: autism tends to run in families. Certain gene mutations have been linked to autism, but not always. Brain development: abnormal brain growth during pregnancy or infancy may affect how brain circuits connect. Environmental risk factors: premature birth or low birth weight, older parents, especially older fathers, prenatal exposure to infections or toxins, for example, valproic acid, alcohol. There is no guaranteed way to prevent autism, but we can reduce risk factors by ensuring proper prenatal care, avoiding harmful drugs, alcohol, and smoking during pregnancy, controlling maternal infections, reducing exposure to environmental toxins, managing chronic health conditions like diabetes or epilepsy during pregnancy. Folic acid supplements during pregnancy may also help healthy brain development, so that's a positive step. But remember, even if you do everything right, autism can still occur. It's not anyone's fault. Diagnosis usually involves developmental screening, detailed behavioral assessments, sometimes genetic testing. Management focuses on support, not cure. Speech therapy improves language and communication. ABA, applied behavior analysis, teaches life and social skills. Occupational therapy helps with daily living activities. Educational support, tailored learning strategies. And when symptoms like aggression, anxiety, or hyperactivity interfere with life, medications may help. Common meds includes risperidone, aripiprazole, for irritability and aggression, methylphenidate, atomoxetine, for focus and ADHD symptoms, stress, for anxiety or mood issues, but no drug treats autism itself, it's about symptom relief. Parenting a child with autism can be overwhelming. Families need more than just medical advice, they need support, training, and community. That includes consistent routines, visual schedules or communication tools, parent training programs, local or online support groups, and importantly, self-care for caregivers. Burnout is real. Let's shift from awareness to acceptance and inclusion. That means training teachers, making workplaces more accommodating, encouraging peer understanding in schools. Autistic individuals have talents, passions, and insights. Some are artists, engineers, musicians, coders, just wired differently. Autism is lifelong, but it's not a life sentence. With the right support, people on the spectrum can live happy, fulfilling lives. Let's stop labeling autism as less than and start building a world that embraces neurodiversity. Like this video if it helped you understand autism better. Subscribe for more expert health content. Share this with someone who needs to hear it. Drop your questions in the comments. We'll respond. Autism isn't a flaw. It's a different way of thinking, living, and being human.